And that report was from Fergal Keane. Now, as the race to produce and roll out COVID-19 vaccines around the world continues to ramp up, there have been fears that richer countries could hoard jabs at the expense of poorer ones. An ambitious international scheme called COVAX aims to make sure vaccines are shared fairly among all nations, rich and poor. But researchers at Duke University in North Carolina say that current models predict there may not be enough vaccines to cover the world's population until 2024, and that it may be the middle-income countries who'll suffer the most. Well, Gavin Yamey is a professor of global health and public policy at Duke University, and I'm also joined by Safura Abdul-Karim, who's a public health lawyer and researcher at the University of KwaZulu-Natal. Very welcome. You're both very welcome to BBC News today. Thank you for your time. Professor Yamey, first of all to you, tell us more about this research looking at availability of vaccines, and as we get a sense of a growing race for supplies, is there a clear link between the wealth of a country and its access to vaccines?
Well, good morning, Anita. I mean, first of all, we should acknowledge that it's just been an extraordinary success developing this vaccine so rapidly. It's so safe and so effective. From lab to jab in under a year, that's the fastest vaccine development in history. The fastest before that was mumps. The Ebola vaccine took 5 years. So the science has been remarkable. Unfortunately, at the same time, as you said, the rich world is hoarding doses of vaccine. Now, look, we've seen this playbook before. If we go back to 2009, you'll remember the H1N1 pandemic, swine flu. We developed a vaccine then, and rich countries went into these advanced purchase agreements with drug companies, vaccine manufacturers, and essentially bought up the whole supply, and poor countries were left behind. They got fewer doses much later. And that is exactly what is happening today with COVID-19 vaccines. It's been a vaccine grab. It's just been awful, really appalling, watching rich nations hoard the supply. Tens of millions of jabs have already happened in the rich world and very, very few in the poor world. And there's an imbalance in who's already bought the doses. Over 4 billion doses purchased by high-income nations, and so far only 270 million by low-income nations. This is a giant global inequity, which is bad not just for low and middle-income countries, but I would say it's bad for people like me and for high-income countries, because an outbreak anywhere can become an outbreak everywhere. And the last point I would make is that it's also economically bad for rich nations. One study showed that if rich countries get fully vaccinated by the middle of this year, but poor countries are left behind, there'll be a $9 trillion economic loss. Half of that will be here in rich nations because of the interconnectedness of the world. Our exports will be down, for example. We won't be able to get parts for machinery. So whatever way you look at it, this isn't just an issue of inequity and justice. It's also bad for public health and bad for the economy everywhere.
Well, a hugely detailed piece of research, much to discuss in that. Let me bring in Safura Abdul-Karim, public health lawyer at the University of KwaZulu-Natal. Safura, good to see you as well. Based on what Gavin was saying about the challenges for various countries around the world, let's look at South Africa, a middle-income country. And what are the expectations around the COVAX project in terms of the amount of money that South Africa should pay for any vaccines?
So South Africa is in a slightly unique position compared to other low and lower middle income countries in that our participation in COVAX is entirely self-financed. So we are paying the same for our vaccine through COVAX as countries like Ireland or the EU would be paying for their participation, which doesn't seem a lot like equitable access when you think about our income relative to those countries. But we have chosen to participate in COVAX. Of course, the problem is that doses through COVAX are only going to begin to be distributed in March, and they're only going to cover a very, very small portion of our population.
So that expectation that you should pay the same for access to vaccines as, for example, EU countries, what sort of challenges is that going to present? Is it going to mean, for example, that South Africa will be able to order fewer doses than it would like to?
I think South Africa is in a slightly different position to a number of other countries because we are able to afford to pay for that. But it is taking a huge chunk of money to pay for those vaccines. The other thing that's being pursued at the moment, and I think what is the biggest issue for people here in South Africa, is the fact that we're paying the same, but we're getting the vaccines much later. So there's been an immense political pressure for government to pursue bilaterals, which of course compounds the inequity because now even upper middle income countries that can afford to pursue bilaterals are sort of dropping reliance on COVAX and moving to those bilaterals, which is just going to make the lack of access for low income countries even more difficult.
Gavin, how do we make this process equitable, where clearly there is a greater demand than there is supply right around the world? Because, as you say, no one is safe in theory until everyone is safe with this virus. But if you're in a situation where you don't simply yet have the numbers of vaccines that you need, how do you make the process equitable?
So what I would like to see, well, a number of things really. First of all, rich countries, I think, should follow Norway's lead. You may have seen that Norway has decided that as it vaccinates its own population, at the same time it will donate doses to COVAX. That will increase the supply to low and lower middle income countries. The second thing I would like to see is, Zafura talked about these bilateral deals that are happening. That I mentioned earlier, rich nations, purchasing doses directly from vaccine manufacturers. I'd like to see rich nations donate doses from those deals to COVAX. I'd like rich nations that have gone into these deals with vaccine manufacturers to share the technology, to share the know-how, to globalize the manufacturing. This is doable, but it takes political will, and it requires rich nations to not take a me first, me only view, but to see vaccines as a truly global public good. And early in this pandemic, there was so much rhetoric from world leaders saying this will be a global public good, we're going to make this happen. But at the end of the day, many rich nations bypassed COVAX. They went straight to the front of the queue. They didn't buy their own doses through COVAX. That would have been helpful if more rich nations had actually bought their own doses from the COVAX mechanism, not directly from vaccine manufacturers. That would have helped subsidize the cost of doses for low and middle income countries. So there are steps that can be
really
taken.
interesting to hear all of those suggestions. And Zafura, you're nodding along with all of that. I just wanted to ask you, if I may, Zafura, as a public health lawyer, about this line that we're getting from the EU and EU officials saying that it's going to be asking AstraZeneca to publish the COVID-19 vaccine contract after saying that the AstraZeneca CEO disclosed confidential clauses. There's obviously been a robust pushback from the boss of AstraZeneca to the complaints from the EU that we started to hear about in the last couple of days. But in terms of the sort of nitty-gritty of these contracts, what would one normally expect? One wouldn't normally expect a contract to be published like this, would we?
So I think there's been a lot of secrecy around these contracts and these bilateral arrangements, and there has been immense pressure everywhere to try and get the terms disclosed because the type of information contained in these contracts provides a lot of leverage, particularly for poorer countries, to negotiate lower prices, to argue for doses to be reallocated where wealthy countries have got many times more doses than they actually need. Of course, there's then immense pushback because these contracts and the contents that's within them can be used to facilitate vaccine equity. It is true that it's often not the case that these contracts are made public, but there's, I think, a very good argument that in the same way that a vaccine is a public good, part of making that public good available is to be transparent in one's dealings with pharmaceutical companies.
OK, well, really interesting to talk to both of you. A lot more that we could talk about, but we are out of time. Thank you both very much. Zafura Abdul Karim, public health lawyer at the University of KwaZulu-Natal, and Professor Gavin Yamey, Professor of Global Health and Public Policy at Duke University in North Carolina.